Thank you for making the decision to donate life-saving plasma. Today you will have a medical qualification and will repeat this process once per year as long as you can continue donating. Before you donate, this video will provide you with important information that will help you understand the process of plasmapheresis or donating plasma, understand what happens to your plasma after it is collected, and learn ways to keep yourself healthy as a plasma donor. Before we discuss the process of donating plasma, let's learn what plasma is. Plasma is a portion of your blood that consists mostly of water. Proteins, fats, clotting factors, immune globulins, red blood cells, white blood cells, and other substances are suspended within plasma. Medications you are taking currently will also be present in your plasma. As a plasma donor, you undergo plasmapheresis, which is the process of taking fluid from the body and returning the red blood cells back to the body. Let's learn about how the plasmapheresis process works. The process is performed with a plasma collection machine and sterile, single-use supplies. This means after each donation, the supplies used in your donation are discarded and new supplies are used for the next donor. During your donation, the following steps occur. First, a phlebotomist cleans an area of your arm. After cleaning your arm, a phlebotomist inserts a needle into a vein in your arm. Using aseptic procedures, approximately 1 pint of blood will be drawn. Your blood travels through tubing, called a harness, and is collected in a sterile container, called a bowl, that is placed in a centrifuge. The centrifuge spins at approximately 7,500 RPMs and will separate your red blood cells from the other components of your plasma. The plasma will be drawn into a plasma collection bottle, and then your packed red blood cells will be returned to you through the same tubing and needle. When your red blood cells are returned, you will also receive very small amounts of sodium citrate. Sodium citrate is an anticoagulant that is used to prevent clotting during the procedure. This process is repeated usually 3 to 6 times until the necessary amount of plasma is obtained. The amount of plasma we collect is based on your body weight. The process takes about 20 minutes to 45 minutes to complete. Now let's talk about how often you can donate plasma. Federal law allows you to donate 2 times in a 7-day period, with 1 full day between plasma donations. Your 7-day period begins the first day that you donate. If you donate twice a week, you may return on or after your regular donation days, but not before. For example, if you donate this week on Wednesday and Friday, you cannot donate until the following Wednesday. Tuesday would be a day too early. We document tattoos and piercings because unsterile or shared needle exposure is a way that AIDS and viral hepatitis could be transmitted. Today we will document all of the tattoos, piercings, and non-medical implants that you have ever had. You may continue to receive new body modifications in the future as long as we are able to verify sterility. Prior to getting additional body modifications, ask us for a sterilization form. The business that performs the procedure will fill out the sterilization form. Once we verify the sterility information, you will be placed on a short hold. Through this procedure, you will be able to continue to get tattoos and piercings. However, you must report them before your next donation to be eligible to continue donating. Also, while you are part of the plasma donation program, you cannot donate whole blood. Whole blood collection includes red blood cells, platelets, and white cells, as well as plasma. Finally, you cannot donate at more than 1 plasma center during the same time period. Here are some things to know about plasma donation. As with any medical program of this type, there is an element of risk and we want you to be aware of it. Over time, the protein and hemoglobin levels of your blood may be reduced by repeated donation. This may require a temporary deferral from the donation program until your levels are back to normal. Next, there is a chance all of your blood cells may not be returned for various reasons during the donation process. This may require deferral from the program for 8 weeks, during which time no fees will be paid to you. There is also a chance an additional needle stick may be needed if the first needle stick fails. While most donors do not experience any problems during donation, there is a possibility that you may have a reaction while donating plasma. You should notify one of the technicians immediately if you feel any tingling in your fingers or around the lips, or if you experience slight muscle tenseness and discomfort. These could be symptoms of a mild reaction to the anticoagulant. The technician will lower the pump speeds and notify a medical supervisor. Some people may experience lightheadedness, dizziness, fainting, nausea, vomiting, rapid pulse, and/or convulsions because of the change in blood volume during or right after the donation. The best way to avoid any of these symptoms is to drink plenty of fluids, especially water. Though extremely rare, some people have experienced allergic symptoms, which include flushing, itching, hives, abdominal cramps, difficulty breathing, chest pain, or bronchospasm. These symptoms could be life-threatening. If you should experience any of these symptoms, please let a donor center employee know immediately. The plasma center physician or one of the medical supervisors will administer appropriate treatment as needed or will refer you to a local hospital for treatment. Although the automated blood collection device is equipped with multiple air detectors to monitor and remove air from the system, there is a remote possibility for air to be infused during red blood cell return. A small amount of air is not harmful. A large amount of air could cause a severe or fatal reaction. Please do not touch the automated plasmapheresis machine. These machines are programmed individually for each donor. If you hear abnormal noises from the machine, if you're not feeling well, or if your needle site is painful, let a staff member know as soon as possible. Now we will talk about what happens to your plasma after the donation. Your plasma and blood will be tested for the following: hepatitis A, hepatitis B, hepatitis C, parvovirus, HIV to test for the AIDS virus infection, syphilis, protein levels, atypical red blood cell antibodies, special antibody screening, and clinical trials or third-party testing. If any of these test results are reported abnormal, you will be notified and may be temporarily or permanently deferred from donating blood or plasma. Your sexual partners or household contacts may also be deferred as a result of your laboratory tests. If you are deferred, the plasma center manager will contact you requesting that you return to the plasma center to discuss your results in a confidential manner. We cannot discuss results over the phone. If necessary, you may be placed on a permanent deferral list, such as the National Donor Deferral Registry and local health departments or agencies as required. These documents will not list the reason for your deferral. There are some things you need to keep in mind about the tests being performed on your blood and plasma. First, there is a possibility of false positive test results. False positive means that a test result suggests that you have an infection. However, further tests by your doctor show that you do not have an infection. For this reason, all positive results will be retested before notifying anyone of a positive result. We always encourage you to go for follow-up testing by your personal doctor or the health department for an actual diagnosis. The tests we use are for screening purposes only. False negative results are also possible. A false negative result means that our screening test does not identify an infection when in fact one is present in your system. For this reason, we must have 2 sets of negative test results from all donors before their plasma can be used to ensure a safe and usable product. We ask that you do not donate to receive free testing, or if you have participated in activities where infection is likely to happen. One of the diseases your plasma will be tested for is HIV, or human immunodeficiency virus. HIV is the virus known to cause AIDS, or acquired immune deficiency syndrome. People with AIDS cannot donate plasma. AIDS is a disease state in which a patient's immune system has become damaged by HIV. Eventually, the patient will become vulnerable to other diseases or infections. It becomes harder for the immune system to fight and eventually leads to death. The signs and symptoms of AIDS include the following: unexplained weight loss, night sweats, blue or purple spots on the skin or mucous membranes, such as the mouth, swollen lymph nodes lasting more than 1 month, white spots or blemishes, rashes in the mouth, fever greater than 100.5 lasting for more than 10 days, cough or shortness of breath that doesn't go away, and diarrhea that doesn't go away. HIV is known to be spread through sexual contact, exchange of blood and other bodily fluids, and through blood and contaminated blood products from individuals infected with HIV. Certain activities that repeatedly expose an individual to the exchange of bodily fluids are considered high-risk activities, as explained on the risk poster that is reviewed every donation. It is very important that persons engaging in high-risk activities avoid donating blood or plasma because they may expose others to potential infections. If you ever identify yourself with any of the high-risk groups, or have signs and symptoms associated with HIV or AIDS, please exclude yourself from donating. If you have any questions or concerns today or in the future, please ask to speak with our medical staff. All discussions and information are strictly confidential. Another disease that you should be aware of is Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease and variant Creutzfeldt-Jakob disease is the human variant of bovine spongiform encephalopathy. Creutzfeldt-Jakob disease, or CJD, is caused by abnormal proteins that find its way to the human brain. CJD can cause tunnel-like holes in the brain and eventually cause death. You can get CJD through genetics, a family history of CJD, or through eating beef, which is contaminated with the abnormal protein. Some people who have received human pituitary growth hormones or a corneal transplant have been diagnosed with CJD as well. There are two types of CJD, classic and variant. Both are fatal. Classic CJD can take up to 30 to 40 years to affect the victim's health, and the victims will usually die shortly after it is discovered. Variant CJD is usually found in younger people. It only takes 3 to 4 years to affect the victim's health, and they will also die. Currently, there are no tests to diagnose CJD, so we rely on answers to questions to determine who may be at risk for CJD. Remember, it is very important to answer all screening questions honestly. There is a remote chance that CJD and VCJD may be transmitted through the blood of persons who are at risk. Therefore, these individuals should not donate plasma or whole blood. Plasma is made into life-saving medicines. Therefore, we want to make sure only the highest quality and safest plasma is being used. If you remember any information even after your donation related to your health or activities which may require us to destroy your plasma or defer you from donating, please let the donor center staff know. This information is kept confidential. Now we are ready to discuss ways you can keep yourself healthy as a regular plasma donor. Fluid replacement is an important part of being a healthy donor. It is important you drink plenty of fluids that do not contain caffeine or alcohol. Do not drink any alcoholic beverages 24 hours prior to and at least 4 hours after your plasma donation. It is also important to have good healthy meals before and after each donation. This lowers your chance of having a reaction and helps your body replace the plasma removed during your donation. Caring for the needle puncture site is very important. Even though we use antiseptics on your skin, there is a possibility of local infection, a temporary rash from the antiseptic, and scarring at the venipuncture site. There is also a chance that a small amount of blood may leak into the tissue around your vein. This can cause a bruise that may last from a few days to a few weeks. Keeping this in mind, it is important to follow these instructions. Report any trouble with your needle site to a donor center employee immediately. Keep the area clean, but do not remove the bandage or wash the needle puncture site for at least 2 hours after your donation is complete. This will allow time for a clot to form to help prevent infection. When you remove the bandage, clean the area with soap and water. Do not touch or pick at the needle site. This could cause additional bleeding or infection at the site. Do not reuse the bandage given to you at the end of your donation. If needed, replace the bandage with a clean one. After your donation, if you have any bleeding, pain, redness, itching, bruising, swelling, or a rash at your needle puncture site, please report it to the plasma center as soon as it appears. It is important to remember for life-saving medicines to be made from your plasma, you will need to donate at least 2 times. After today, the donation process will go a lot more quickly. Before we end, let's review what you've learned in this module. At the beginning of this educational video, we told you by the end of this module you would understand the process of plasmapheresis, know what happens to your plasma after it is collected, and learn ways to keep yourself healthy as a plasma donor. If you do not feel comfortable with any of these learning objectives, please ask an employee for assistance. Thank you for making the decision to donate life-saving plasma. Please let an employee know that you've completed this video.